and fear. Often the fear is related to being re-injured if it is something like a car accident, but it could be even arthritis pain, which is a chronic condition that when I look at a medical chart for my occupational therapy patients, and OA, osteoarthritis, is not on the list, I'm surprised. So it's very, very, very common. Um, so it can be either a specific experience or just our body, but we're afraid of doing too much because the next day we are expecting to have more pain. Um,
Mary, why don't you go ahead and tell us a little bit about your passion for yoga and your history.
okay. Um, Thank you for having me. First of all, I'm really excited to be a part of this. Um, I am the one who answered I practice, and that's really my relationship with yoga. It's not very formal at all. One of our participants said that they like sun salutation. And it reminds me about my first experience with yoga was when I was a brand new mom, and I was very sore, especially in the shoulders, upper body from carrying babies. And I ripped out a page from a magazine that had the sun salutation, walked you through each pose in pictures. And that's what we're going to be doing today, actually. And I had it posted on my bedroom wall for a very long time. And I love it as well. So, didn't, you know, I ripped it out and I was going to do it every day in the morning and I was going to do it perfectly. And that didn't necessarily happen, but a couple of times a week, sometimes in the evening, which reminds me of another aspect of yoga, which is how forgiving it is. And there's truly no expectation of perfection. And there's no room for judgment, at least not at least, not judgment of ourselves or of others. So I just love it for those reasons. Um, Professionally, I am an occupational therapist. OT. It is April is OT month. So I'm wearing my OT t-shirt. So I'm an occupational therapist. I primarily work with older adults, and I haven't been an OT forever, but I've been an OT for long enough to see over and over and over how pain affects almost everyone. When I ask someone about pain and they say, I never have pain, that is definitely not the norm.
Liar, liar.
Yeah, yeah.
With
Um, and and I've also been an OT long enough to have experienced the opioid crisis, where doctors used to medicate right away and refill, and those options are not available to us any longer. So, adapting and knowing and practicing other ways to address pain is really, really imperative. And yoga, in my experience with the people I work with professionally, personally, and myself, is that it's proven to be beneficial.
awesome. With that, let's get an idea of how many liar, liar, pants on fire in the audience. Tell us about your pain, aches and pains. So where do you feel it? And I'm sure the lucky ones are people like myself who don't have anything that's, yes, this blank has always hurt and it won't go away. I have last night, after doing a whole lot of house cleaning and stuff, there's a place on the back of my shoulder, like where exercises of rows would be, that was so sore. And I'm thrilled to announce this morning it's feeling a lot better. And other times you wake up and you're like, oh, I slept in that position again, didn't I? And um, you know, You have some parts that are more prone to it than others, but nothing too acute.
Well, it looks like back pain wins out with 57% so far.
Yeah,
My wife isn't on the call, so she can't say I'm the pain in her neck, but that's second, with hips and shoulders being the other. And
yeah,
then
we're about
as far as,
split
yeah,
between,
for,
Everything else.
yeah.
yeah.
How often is,
Mhm.
we don't have, this group isn't the all day, every day, or several times a day. It's per week or per month. So we're pretty lucky.
Good.
And before we hand it over to Mary to share her expertise, let's give her an idea of what we already understand. What do you think of when you think of acute versus chronic pain? Not everybody all at once.
Right. I was just going to say that chronic pain and acute pain sometimes can be the same thing, right?
Mhm. It can, yeah.
Yeah.
And acute pain usually goes away, but when it doesn't go away, then it turns into chronic
Chronic
pain.
pain, yeah.
Mhm, mhm.
Or it makes me think of my math teacher's bad joke. Acute angle is the one you want to take to the prom.
Oh, geez.
Oh, geez. Well, for this one, 71% responded last different amounts of time, and then from different causes is the next big thing, and can improve with treatment. So when we understand our chronic and acute pain, that seems to be the thrust of where we're at in our group here.
So Mary, why don't you go ahead and share your expertise on this subject with us? I'm gonna
Okay.
let us hide into the background for a little bit. We'll keep an eye on chat. Let us know when you want to take questions, any of that fun stuff. We are happy to chat.
Mm. Okay. Okay, so can you guys see my slides now?
Yes, we can.
Okay. All right. Okay. So yoga to address chronic pain is the name of this presentation. And I really do want one of the take-home messages to be that this is to address chronic pain and not acute pain, because in most instances, acute pain is the result of something specific and something transient. Um, and so a headache could be an acute pain. And my kids joke with me that I believe that water can solve every ailment. Um, and for me, that's what does fix a headache, is drinking more water. That's usually the first thing that I address. But it doesn't last a long period of time. But also a break, a strain, a sprain can be acute pain, or severe back pain, for example, that's a result of you doing a bunch of yard work, shoveling and hoeing and pulling weeds. And I'm not suggesting that the practice of yoga is a good intervention for the acute pain. I believe that you should use ice, rest, maybe a medication, sometimes heat if it's muscular, and then if it lasts more than a few days, talk to your doctor. Chronic pain, um, here's a slide that kind of explains those things. Chronic pain usually lasts longer than 6 months. By that point, maybe you've already talked to a doctor. It's not going away. For something to be chronic pain, it doesn't mean that it's bothering you all day, every day, and it doesn't even mean that that it's in the same part of your body. it can be kind of generalized. And we'll talk a little bit about that, about how much the mind is involved in the experience of chronic pain. Um, like I said, acute pain happens quickly. Thank goodness it usually goes away quickly. Um, Sharp pain is something that I would like for you to kind of put in your mind. Acute pain is oftentimes sharp. And also when we talk about yoga and when we talk about some of the yoga moves that I have in this presentation, and when I say go ahead and rip that sun salutation out of the magazine and practice every day, um, or a couple times a week or whatever it is, by all means do. However, yoga is not an activity where you should expect to feel sharp or stabbing pain. And it's not an activity where you should feel no pain, no gain. It's really a very gentle stretching and elongation. And over time, you see results, but not right away. It's not like if I just push harder, if I just stretch harder, if I just hold it longer, I'm going to get more. If you're doing those things and feeling sharp pain, then you're doing it wrong. And that's not what we recommend. So understanding chronic pain, first and foremost, it is very complicated. And that's kind of good in a lot of ways, especially when we are talking about yoga as an intervention. With chronic pain, the body can become more sensitive to threat, even when the threat is minor or non-existent. And the brain is more likely to interpret situations as threatening and sensations as painful. So that point is quite interesting to me. If we are expecting pain, then our body is sensing, is expecting, is reacting to the littlest thing, as the littlest stimuli, as painful. And it's because it's what we've known and what we've expected. There is study after study after study that tells us that the experience of pain over time is related to our mind and the way that our mind and bodies interact and the neurons. It's neuroplasticity and neuroscience is at the forefront of studying these pain sensations and the interpretation of our bodies. The pain you feel may reflect a mind-body response that has become overprotective. So, like I said, you're expecting something to go wrong. So the littlest bump, the littlest I slept wrong, the little, I don't have my pillow. The older I get, the harder it is for me to travel. Because I don't have my right pillow and I don't have my right mattress. And because of my experience of pain over time, my body is truly going to respond to those things with pain the next day. Whereas if I didn't have experiences over time, my body may not have responded to that same not right pillow or not right mattress as it does. So it can be kind of complicated. But when we think of the information in these slides, I also want you to imagine like you're seeing a scary movie and you're in that like heightened sense of awareness. The light is just right and they're playing the spooky movie and something is about to happen, so that when it's just like a ball hitting the ground, you jump. This is really the same idea.
It sounds to me kind of like post-traumatic stress.
And they have
nerve endings.
Exactly.
Because of the history, your brain starts to see it go down that track and just assumes.
Yep, exactly. And there are many, many, many studies that that link the experience of chronic pain with a PTSD. Even if there wasn't like one particular, PTSD is often linked to one particular traumatic experience, and the chronic pain might not be. It might not be related to an accident, a car accident, a motorcycle accident, a fall down the steps. It may be just over time, or, your body arthritis over time. But that PTSD kind of reaction is very, very similar. So yes. Okay. How does chronic pain affect us? Tense muscles, limited ability to move around, a lack of energy, changes in our appetite, depression, anger, anxiety, and fear. Often the fear is related to being re-injured if it is something like a car accident or, a fall, something like that. But it could be even arthritis pain, which is a chronic condition that I don't know what the number is. I should have that information. But when I look at a medical chart for my occupational therapy patients and OA, osteoarthritis, is not on the list, I'm surprised. So it's very, very, very common. So it can be either a specific experience or just our body, but we're afraid of doing too much because the next day we are expecting to have more pain. Um, the lack of energy and changes in appetite is interesting to me. And I've studied I've studied kind of those correlations, and that is really related to the history of not doing. So sorry, something was popping up on my computer. So just like you use it or lose it, when you start to be more stagnant and not move, you're going to continue on that, on that trajectory, and you're going to not move. And you might have started because you were afraid of overdoing it, which would increase your pain. So, but the result is we have less muscle mass, we have less energy. We really, really do recommend doing a little bit often throughout the day, be it yoga, be it movement, be it whatever it is, to get up and move very, very often, at least once an hour. So if you've ever had occupational therapy, physical therapy, if you've ever been in a hospital, then you've heard you need to get up every hour, at least for a minute, at least stand through a commercial, at least walk to the bathroom. Otherwise, our experience of pain increases significantly. So I have been doing a yoga program for a long time. I teach occupational therapists, and I go to senior centers and, for different audiences. This might be the first time I've done it during COVID. So the first time I've done it in the last year. But I will say I hear more and more often that younger people are experiencing more pain than they did in the past. And that can be related to what our experience during the virus has been. So more time seated, more time at home alone. We have increased social isolation. Yeah, even if we are getting up and moving, it's within our own house. So you might think you move all the time, but you used to park your car and walk to an elevator. And now you're, like I said, walking to the bathroom, walking to the kitchen. So the activity over time in the past year for most of us has decreased. And then point 3, right now, I'm trying to pivot and flex at my hips. However, I need to do that consciously. Generally, when I'm working on a computer, I am like this. I'm in this flexed position, shoulders, neck is down, shoulders are forward, my core is curved. And that's the position that many of us are in for extended periods of time. And it exacerbates our just muscle soreness and our arthritic changes, our arthritis, and then just the stiffness. That's a lot worse now as we're sitting more and more. I used to work home care, I still do. but I used to work full-time in home care, and I was always typing at night. And I thought, I mean, I literally thought I was going to have cervical surgery, so neck surgery. Um, and as soon as I stopped working home care, sorry, my computer again. As soon as I stopped working home care, that neck pain went away almost immediately. And it was because I was opening up, not spending so much time in that flex position. So I encourage you, if you leave this presentation today and don't practice one moment of yoga, this is actually a yoga position that we're going to talk about. And do that extending our shoulders back, our neck back, curving this way, because when you think about your normal position, it's the exact opposite. Even if you're sitting in a recliner, it's the exact opposite. So we need to push our bodies into different positions.
Mary, I think you bring,
Myself,
oh, go ahead, sorry.
I caught myself this afternoon. I went for a walk while it was still sunny in between church and this, taking advantage of that moment, knowing the rain was coming. And when I was first doing it, I was listening to my podcast and looking at the ground and plodding along, and you would have thought this was drudgery, even if you had looked, my heartstrings were sunny day, just saw friends, happy go lucky. But I realized I had that moment where you realize my posture looks like I gotta get somewhere, like stuck in that mode. And I worked really hard at head up, chin up, shoulders back.
Mhm.
And it feels good when you do it, but you do become aware of how not normal that is.
Mm-hmm. Mm-hmm. There have been times in my life when I had better posture as a default, but to have it as a default took a lot of work, right? There was a lot of practice involved before my posture became more upright. But the flexing at my hips, so your hip flexors, like where your leg muscle meets your, well, it's where the top of your leg is. That I would encourage everyone to to have that become your norm. Instead of curving at the spine and curving at the shoulders to lean forward, keep your back as straight as possible and lean forward at your hip flexors. And Tim, what were you going to say? Did we miss it, or are you
Oh,
good?
no, I was going to say the pandemic kind of, because I had to be on so many different Zoom meetings because so many in-person things were canceled. I noticed that I try to be in an area where it doesn't show too much background, but then I do these stretches where I'm constantly straightening out my back and I'm constantly adjusting my camera up and down. And I never realized how much I moved like that because, like you, I'd get to typing or working on a computer and instantly my shoulders are hunched in and my neck,
Mhm.
I'm leaning forward, and it makes it, it gets sore pretty quick. And
It
and
does.
I was just chuckling because every time I'm on a Zoom meeting, I'm adjusting my screen where my camera is up and down so that I stay in the middle of
To
it. But
change your position.
right,
So you're taking the advice of the OTs and PTs in the world that say
yeah,
at least once an hour, you have to
right,
change your position. So you're making your camera do that for you. That's
right.
good. I like it. Okay, so how can yoga help? We know that chronic pain is an issue. We know that for many of us, it's gotten worse recently. Um, and there are many interventions. I'm not going to lie and say that yoga is the only one. I will say that since that opioid crisis, where medication is not the go-to intervention, physical activity and position changes are probably the top two interventions that are suggested by doctors and nurses and therapists. And yoga is, in very simplistic terms, position changes and physical activity. And breathing, we will see, is so very important. It's 1/3 your yoga practice. There's 3 parts to yoga, and that's an equal part is the breathing. So where I work, we have our documentation system, and we have to talk about pain, and we have to say, yes, this person checked the box. Yes, they have pain. What interventions did we discuss? And ice, heat, position changes, breathing exercises, distraction, those are, and then medication is kind of at the very bottom of that list. But all that other stuff, the distraction, the breathing, the movement, is all included in your yoga principles. So really, really important. So modern science and yoga agree our present pain and suffering have their roots in our past pain, trauma, stress, loss, and illness. Think of, I'm expecting it, so I'm more sensitive to it. Chronic pain starts in the brain. That doesn't mean you can turn it off, though. That doesn't mean it's all in your head. So just change your attitude and you'll be better. It's not that easy. However, acknowledging that chronic pain does start in our mind, and the way our mind and body are working together is an important part. You have to at least acknowledge that that is the truth, so that we can address ways to reverse it. By understanding chronic pain as a mind-body experience, and then using yoga's toolbox of healing practices, one can find relief from pain. And I don't know if I put it, usually I say it's really good news, the fact that yoga, or the fact that chronic pain is in our mind, because that means we can do something about it. The answer is not just surgery or medication or going to talk to your doctor. We can actually do something about it on the ground level, at the root of the issue, and we can do it for no money, very little time. We can make a difference. So I find the fact that chronic pain is so much a part of the way we think. I find that so refreshing and so positive and uplifting. And then it talks about, the breathing exercises and restorative poses can result in decreased pain. The best way to unlearn chronic stress and pain responses is to give the mind and body healthier responses to practice. And I capitalized practice because you, as a person who uses yoga in your life, you should always think of yourself as practicing. And even if you go to a yoga studio and you're taught by an instructor, they are practicing as well. I don't know that anyone is, a master at yoga. There's always room for changes and improvement and evolution. And be kind to yourself, because doing anything is practicing yoga. So what we're going to do today is practicing, even though we're doing very, very little. We're still doing yoga. It all counts. So that's another reason why I love it. Yoga originated in India over 4,000 years ago. I've read even 5,000 years ago, so I'm being maybe a little bit conservative. It consists of 3 core elements: physical postures and poses, which is asana, breathing, pranayama, and meditation. And those 3 elements are equal and equally important. So it's not about the perfection of the way you're holding your body. It's not about how long you can hold your breath, your inhale and your exhale. And it's not how long you can train your mind to stay in a meditative space. It's a combination of all 3. And with all 3 of these core elements, the really, really important take-home message is we're non-judgmental. We are allowing ourselves to just truly feel and be in the moment. And we're not even comparing it day to day. We're thinking, this is the moment we're in. We're going to try to feel our body. We're going to try to breathe therapeutically. We're going to try to keep our mind on what we're practicing in the moment. Period. You can have goals over time. You can have like a handstand as your ultimate goal. But the practice of yoga, it isn't something where you can necessarily, so for running, for example, you're training for a marathon, it's very typical for you to have a book or an app or whatever, which says, day 1, week 1, day 37, it's like an 8-week program. Sorry. And it can dictate for you exactly what you have to do. You warm up for 5 minutes, you run for 30, you cool down for 5 minutes. Some places are even prescriptive to a point where you have a specific pace that you have to keep. So we're running a 6-minute mile for 30 minutes, this many times, and that will result in our ability to run 26.2 miles. Yoga, for better or for worse, is not really like that. You can think in your mind, I want to do that handstand by the end of the year. For many, many people, it takes years to get to that one position that they want to accomplish. Years. And truly, I believe from anyone I know who practices yoga on a regular basis, if I asked them if they were disappointed at how long it took them to get to that goal, whatever their big goal was, were you disappointed it didn't happen in a year? They would say no, and they would believe it because it is about the experience. So now we're going to get into some of the actual practice of yoga. And the first is not a pose. The first is a practice. This is my absolute favorite intervention to practice on myself. I don't usually practice it with my patients because it can be time consuming. And oftentimes it's referred to as body scan, or breathing the whole body. So breathing the whole body is a visualization practice, and it's adapted from ancient yoga practice. It has been modernized. So it's an adaptation. It's not like a true practicing of what was actually practiced 5,000 years ago. In this practice, you imagine or visualize that you can inhale and exhale through different parts of your body. And usually you start in your feet and then work all the way up your body. Imagine, my husband, he has issue with this slide that I want you to imagine your nostrils are in different parts of your body. So maybe that is kind of a gross thing to think about.
I was thinking the exact same thing. So.
You're like my husband. Sorry. I'll have to rethink this. But so maybe not think about that, but I do want you to think about when we are visualizing our feet, or if we have a long time, you can visualize just your left big toe. You think about your breath coming in and out of that toe. And then you go to the next 4 toes on your left side and you think going in and out. It's important to be in a very comfortable, relaxed position. There's corpse pose, which that's usually the pose I am in, which is just laying on my back. My hands are on my stomach. And if I'm feeling very tense, sore, whatever, then I'm supporting myself with pillows. So oftentimes I put a pillow under my knees so I can be in a flex position. Sometimes I have like a towel or something under the middle of my back. This is not something where you are trying to be as straight as you can. It truly is comfort so that your mind is not thinking of anything that hurts, anything that's uncomfortable. Your mind can really focus on the breathing through the body. I do it usually with my hands on my stomach. Some people do it like arms out. You can do it sitting in a chair. You just want to start by relaxing everything. There are many, many YouTube videos, and frankly, this is the way that I do this practice. I I have not perfected leading myself through a body scan. I need to be directed. And YouTube is my favorite place to go. And I I guess I'm sensitive to different sounds, and so I oftentimes choose based on the voice of the person who is leading the meditation, for better or for worse. That's just me. Sometimes I choose based on the length of time I have. There are YouTube videos that guide you through. There are videos for 6 minutes, as little as 6 minutes, that I have found and actually practiced, and then up to 2 hours. I've never done one for 2 hours. But I try to do 15 to 30 minutes practices of this. And there are days when I just know I need it, and I make the time, and it is so, so very worth it. I'm going to see if I can play a minute. Let's see here.
Well, while you look, let me ask. I've started a scan before and fallen asleep.
And that's okay.
And I have heard it is a good tool if you suffer insomnia to go
Mhm.
to.
Yep.
Sometimes, like, the goal would be to learn to be in a relaxed state without being unconscious.
A lot of people do use that as their tool to get to sleep. So don't think you have to make it all the way to the top of your head in order to get the benefits from a body scan. For me, I'm like a weird person who I can never fall asleep to TV or to a book on tape or anything. So I do my whole scan. For me, the goal is, it's almost like a massage, right? Some people can fall asleep through a massage. It's almost like you're massaging yourself. And my goal is to get the whole body, so to get the whole benefit. So whatever works for you is okay. But to your point, lots of people use that as their nightly routine, and they never get past their kneecap, or some people never get past their ankles. So I'm going to see if I can play.
You may have to stop sharing this screen and start sharing the other window.
Okay, hold on. Okay, can you guys hear me now?
No.
I can hear you.
I can hear you speaking, but not you playing something.
Simply focusing on the breath,
Yes.
inhaling and exhaling.
Okay, so I am just going to play a couple of minutes of this. This is a 15-minute body scan meditation that's on YouTube. It's free. It's just an example of what I'm trying to explain to you guys. So, we'll listen to maybe a minute or so. So I would ask you in the audience, you don't have to lay on the floor in corpse position and support yourself with pillows, but perhaps you want to close your eyes, get in you can do that slouchy position that I told you not to do before. You can do that now. Drop your shoulders, rest your neck, be very, very relaxed as you can. There's no right or wrong, but let your legs fall out. It's just simple, like you're a wet noodle. So try to do that and listen, just to give you an example of what I'm talking about with this breathing through the body.
Noticing how it moves into and out of your body. Take a moment to allow your attention to simply rest in the body, using your breath as a tool to experience what it's like to fully inhabit the body. With each in-breath, know that you are inhaling strength, loving kindness, vitality, and healing energy. And with each out-breath, know that you are letting go, letting go of whatever you need to, physically, mentally, and emotionally. And now easily and gently, bringing your attention down to your left toes, all 5 toes. Just sensing what it feels like in that part of your body. Noticing any sensations that arise. Breathing all the way down into the left toes. And now easily and gently, bringing your attention to your left foot. Just noticing what it feels like in the left foot. Breathing into the left foot.
Okay. So I hate to stop it. Because
It,
it's
it
so lovely.
it's very soothing to like listen to somebody talking softly and
Mhm.
I was sitting in a very uncomfortable chair, so it was difficult for
Oh,
me to totally
okay.
relax, but it was good.
But yeah, so what I wanted was for it to just illustrate what I'm trying to get at. And so she goes left toes and then left foot. And what I like about this is she says, you're breathing into it. She doesn't say, exhale for a count of 5 and inhale for a count of 5. And that's what I recommend to you, this audience. And that's what I recommend to when I'm teaching yoga to my own students and patients. They say, okay, we're going to inhale for a count of what? And we're going to exhale for a count of what? And that has its place. A lot of my patients have lung issues. You know, they have COPD, they have emphysema, lots of smokers. It So my advice is to try and inhale and exhale for an equal length of time as much as possible. If counting helps you, then fine, but you are listening to your body and inhaling and exhaling to what the body is asking for. You can't rush it and you can't slow it down, and still be comfortable. Okay. So, when I have patients and their oxygen levels are dropping, and I say you have to breathe in through your nose and you have to breathe out through your mouth, they immediately start to go and their oxygen levels, because I have a pulse ox on their finger, their oxygen level goes down. And then they start to panic. And I say, that's not what we're going for. I'm not saying to go fast. I want you to breathe in through your nose, and out through your mouth at the pace that your body needs and is going to benefit from. And as soon as they do that, where they're not rushing it, the oxygen level starts to go up. So when you're doing a body scan, I personally, as a beginner, would encourage you to, if you're walking yourself through, great. Or if you're going to YouTube to search for that video that's going to help you, that's fine as well. But as a beginner, just have it be like the one that I just shared with you, where she doesn't say, breathe through those toes, a count of 5. Because that's not going to be, that's not going to be your core experience. It's going to be hers. So it's just kind of hard to dictate. Okay.
When
There we go.
I've been nervous in situations to regulate that panic breathing, what works is to put your fingers up, your 4 fingers, and think of them as candles. And you're going to inhale and you're going to exhale and blow the candle all the way out. And a lot of times it's the exhale that we cut short. And so blowing that candle all the way out gives you lots of room to bring in new oxygen. And by the time we're down to the 4th finger, As a kid, we got to the point where my mom would just hold up her 4 fingers. If I didn't blow them down, we were just going to stand there and look at each other. What are you 4?
Oh, that's funny. Okay. That's great. I love that your mom was having you do that as kids. That's great. My mom had COPD and she was on supplemental oxygen. And she said once, the next person who tells me to smell the roses and blow out the candles, I'm going to kick them. And so now when I say that to people, I always stand like far enough away where I can't be kicked. Because you do hear the same thing over and over, but to your point, when you actually practice it, it does relax your breathing. It does allow you to be present in the moment instead of in that panic mode. What do I have to do next? What just happened? What's going to happen next? How is this going to hurt me? You know, all of that. It kind of brings you to the moment because you have to just focus on that candle, blowing it out. Love it. The next slides, we're actually going to talk about some poses. And if I was teaching this class to you in person, I would have said, bring your yoga mat and we're going to go through 4 or 5 poses. And this would be one of them. And I like this pose. I like this illustration because it shows a supported angle. The bottom one you can see. There's pillows supporting her knees in a more upright position. And also her arms are in different positions. So I have frozen shoulder on my left. I can't do that. The top one where she's doing the, what is that? Like the football, whatever. The field goal. I can't do the field goal because my left arm doesn't work. So I would have to go straight out. Does that make it wrong? No, it doesn't. And this is showing you that the pose can be done in whatever is comfortable to you. The goal of it is extending. So you're laying down and you're extending your knees outward and you're extending your shoulders outward. Once you get into the outward position, then you focus on the breath. So our first goal is to get in an extended position and we're comfortable. We're not having any of that sharp pain that I said we need to avoid. If we can't be comfortable without bolsters, which is pillows, blankets, whatever it is to support you, then that's okay. Get something to support you. Get in a comfortable position, and then you focus on your breath. And once again, you can breathe to counts. That's usually what I do, but how quickly I count is not going to be the same as how quickly you count. So I count to a 5. It could be what you would count to an 8. And that's okay. It's not like the length of time that you have to hold it for. And it's just a resting, extending pose, opening everything up, counting. I don't hold any pose for more than 5 inhale, exhale. Sometimes it's 3, and that's because of my audience usually, which is older adults, and we don't want to overstretch, overextend anybody. So I usually do 3 to 5 repetitions of each pose. The back bend pose is another extension. And in this one, it's showing you the person is just standing up straight, and you're extending backward, backward, backwards. So 1, 2, 3, 4, 5. There's number 5. As you perfect this position, or as you make this position, as you modify this position to your needs, so it becomes too easy, getting to this number 5, this is the position where someone is actually, her hands would be on the ground holding a back bend. I can't do that. I've never been able to do that. It feels wonderful just to get to your end point. So generally, I am breathing in as I get to my endpoint on Monday might look like the person in picture 2. My endpoint on Thursday might be the person in picture number 5. Okay. Your endpoint is where you feel a stretch and you feel no sharp pain. And then you're going to inhale as you go back. And you're going to exhale as you stand back up. Once again, we're doing this 3 to 5 times. This slide, so now we're going forward instead of backwards. The first 2 positions were extending. This is flexing. And this is a forward bend starting in a standing position. This illustration is showing you just how different it is for different people, or maybe the same person on a different day. It's not going to look the same. So the modified with block, that's more of a beginner pose on the bottom left. And to her right, the modified pose where the lady, instead of having a block to hold on to or to support herself, she's just putting her hands on her lower legs to support herself that way. Either way, that's the modification. You might not even go that low in the beginning. And I'm sorry, my dog is barking. I hope you can't hear it too badly. And then the full pose, which is the top left, is the full pose. That's a forward bend. So that's when you're having a great day or when you've been practicing for a while and you can get to that full position. You're breathing in as you are upright, and you're breathing out as you're getting into the flex position. Breathe in as you go up and release the pose. Breathe out, get that air out so that you can flex more when you're entering into the pose. This can be done sitting on the ground, laying on the ground. This can be and should be done with lots of supports. For anyone who wants to practice yoga, you can do this with pillows or blankets this thick, sitting on your lap. You do not have to look like the person on the top left of your screen. Okay. Cat cow is my favorite. Other than the body scan, this is the one that I do. Sun salutation, cat cow, and the body scan are what I do almost all the time. I'll do one of them every single day, if not all 3, because it just feels so good. So in the bottom one, it's the cat, and that's just, think of a cat, when they're stretching their back, and then the cow. So it's the flex and extend in one movement, or in one pose. You're breathing in for one of the positions. The cat, you're breathing in. The cow, you're opening everything up, flexing out, and you're exhaling. Once again, we're avoiding any sharp pain. You don't have to do it on all 4s on the floor. I'm sitting in a chair. To me, this counts, where you're flexing all the way forward, your neck, your shoulders, your back, you're flexing all the way forward, and you're exhaling and extending everything out. Do it in sitting if you want, it still counts. And that's the beauty of yoga. You hold the cat for longer than you hold the cow, it's okay. That's the beauty of yoga. Your person next to you is holding it, or is counting their breath for 10 to inhale and 12 to exhale. That's their practice. Your practice might be quite different. especially when I'm telling you, as you practice these, I want you to hear Mary Molnar's voice saying, this is your practice, this is your comfort, and you are not experiencing sharp pain. That might mean you have to practice the pose for a lot shorter, especially a shorter period of time, especially in the beginning, in order to not feel pain. That's all I have for the actual yoga poses. So tell me how you guys are feeling, and if I can answer any questions, go over anything else in specifics. Are there questions?